Absolutely. The question we're braced with in the campaign is really to get the community buy-in, get the buy-in of the health workers,
Mm.
get the buy-in of the teachers and so on, and to make sure that there's enough vaccination centres. The portal is all good and well, the electronic cell phone registration. Many people have cell phones, but not enough. We need everybody's hands on deck here, and we need community participation. So it's going to be critical that there's fluidity in the distribution system, that we don't wait a full 3 months for all our care workers to be vaccinated while there are vaccines sitting in the fridge. The
Yeah.
international experience has shown that often, these jabs can go out of date. They only hold for so long in the fridge, and it means really being very nimble and understanding that massive levels of education need to take place, and that needs to be state funded. There's lots happening at the moment, but it needs to be scaled up by the South African government. It needs to be funded. So this is the question that we're really gripped by: is how do we engage with the Department of Health in a coordinated manner, where a number of layers of society are engaged about, what's appropriate, how close does a vaccination centre need to be to the nearest population. We can't have people like in other parts of the world, developed parts of the world, where they're travelling 100 kilometres, 150 kilometres to get a vaccination. It's going to undermine equity. We need health equity when it comes to vaccinations. So all frontline workers in the health sector would include everybody that needs to be involved in the vaccination efforts. So that's GPs, receptions, pharmacy workers, anywhere where large numbers of people are coming together to get their vaccination. And that requires more than intention. It requires a very clear and detailed strategy.
Mm.
And we're not wasting time. We're rolling up our sleeves and working on what that needs to be.
Yeah. And I mean, in terms of learning lessons from countries that have already started their vaccine rollout plan, that are well into now weeks of vaccinations already. In the US, for example, there have been reports of hundreds of thousands of vaccines having to be destroyed because new batches of vaccines were being delivered.
Yeah, well, it's just not getting out in time, and the time factor here is critical, because as we know from the leading public health officials in our own country and abroad, that mutations are happening fast. That nature abhors a vacuum, and under pressure, the virus is mutating, and it's mutating fast. And the only way we can stop the development of further mutations is a very speedy, efficient rollout. And that requires complete fluidity. It requires tens of thousands of people put out into the field to talk to people, to register people, to find the vaccination centres, to get them signed up. We need a central coordination centre which uses the best high tech in order to be in immediate communication with as many people on the ground as possible. And this requires the ensuring in this public health rollout that all the logistics that are available to us, all the technology that is available to us from the private sector is utilized for free delivery, for free vaccines at the point of delivery. Now, how are we going to get people to these vaccination centres? How are we going to get these vaccination centres up and running? How are we going to get the people who are doing this vaccinated in time? This is a major operation, and it involves a collective of the best brains available to us, but also the people who have the knowledge, the local knowledge on the ground.
Mm. In terms of what you know about government's vaccine rollout plan, Rehad, as the People's Vaccine Campaign, how many vaccination points do we now know have already been confirmed and will be ready when the rollout begins in now less than 2 weeks' time?
Well, it's been stated to us it's going to be 200 vaccination centres. Our view that simply is not enough. Not enough to keep. It's a very big country geographically, and people spread out far and wide in our country, and that requires, I think, some more thought to be put into the matter, much more consultation, much more co-determination, so we get the ownership, the community ownership that's required. Otherwise, people are just going to, be waiting, unconvinced, or without the resources to get to where they need to. The level of vaccine hesitancy in the country is extremely high. We're one of the highest in the world, and I think that's partly because of our lack of literacy when it comes to science education. It's only there amongst a small percentage of our population. Those people we have to second people from all sectors of society, from industry, from other public, from the teachers, who can explain these things well, to the community leaders, to the tribal leaders, and we're not seeing that. We're not seeing the efforts really being strong enough in this regard. We need to be bold. We need to be imaginative. And we need the details, and that's what we're not getting at the moment. So it's very hard to grasp where the government thinking is, why they're thinking only 200 centres. Today in my own province in Gauteng, there will be the plan will be presented to the health committee. Let's see what we come up with, but unless we are learning the lessons that we need to get those jabs out of the refrigerators into people's arms as soon as possible, and we have to operate in a fluid manner. That's key. 3 months for healthcare workers, 1.25 million people. Given that many of these workers are in places where qualified people are there to give the vaccine, it's simply not good enough. We can do this faster. We need to be more ambitious.
Yeah, and I think that's what government has also said before. Gauteng is rolling out or giving more details on its plan today. It's hoped that the provinces will also give more detail on their own provincial plans for the vaccine rollout. In terms of the People's Vaccine Campaign, Rehad, how closely, if at all, do you work with government in terms of checking on what the vaccine rollout plan is and perhaps advising in some way?
Well, we're on certainly heavily involved in the social listening project, which is the education project, and we're pushing forward a popular education approach where a progressive pedagogy is involved, where we listen to people first and foremost, and we work on the basis of what people are saying to us and respond to it in an appropriate manner in the local languages and the local idioms and so on. And we have training materials for that. This Friday there's a big meeting, and we're going to be proposing very robustly that this education, this type of education, needs to be rolled out very quickly and forcefully around the country, and we need government support to do it. We're in touch with people from the Vaccine Acquisition Task Force team. There have been plans to try and decentralise procurement. To date, we have found ourselves in opposition to those elements. AfriForum, the Institute of South African Race Relations, Solidarity, or other people are arguing, I think the Council of Minerals are arguing that they should have the right to procure independently. We're of the firm belief that we need one country, one plan. Everything needs to be based on a national plan. It needs to be based on priorities which are evidence-based, scientific-based, those most vulnerable. Now, we know our teachers, for instance, are very vulnerable because there's a higher viral load in the new variant, and we've seen 1,700 teachers already succumb to COVID. We can't afford any more. We can't afford for our police officers to go down in the numbers that they're going. We can't afford for our mine workers who are going underground in contained spaces together in large numbers to be getting sick as they are. So we need a public sector driven plan, but with very deep involvement from the private sector. So we are calling for government to hear our plan, which will be detailed soon, to engage us, to include us on the various task forces and provincial rollout plans. We want to respond to every province's plan, but we do understand there's real unevenness when it comes to our provinces. It's a provincial responsibility health, which many of us believe never should be the case. It should be, the National Health Service needs to be in the hands of a national department, because we don't have the capacity or talent often in many of the provinces to do this as it needs to be done. Unfortunately, we need to centralise this service. We've seen a very uneven response to the health, this health crisis we're facing. Many provinces are in utter shambles when it comes to the hospital services, the oxygen, the ventilators, the number of ICU beds, the staff. We need to unfreeze the 130,000 posts that have been frozen in the health sector to get people in there and trained up to provide the vaccinations that are required. Without an end to this austerity in the Department of National Health, we're not going to be able to meet this moment in time without the unnecessary loss of tens of thousands of lives, maybe hundreds of thousands of lives. Our fear is the third wave may be much more severe than the second wave. Certainly it's going to be as severe. We know that the 20,000 lives plus, these are official figures, but never mind the excess deaths, let's add another 25,000 deaths to that, have been lost in the last 2 months. So there's no time to be just sitting on our laurels. There's no time for ego. There's no time for turf. We're pleading with the government to get us all the national bodies involved in health, all the civic organisations involved with community education and community participation involved in the here and now.
Yeah, absolutely. The biggest vaccination rollout plan in our country's history, in the history of the world, the very recent history of the world. Rehad Desai, thanks very much for your take on this story. He's with the People's Vaccine Campaign.